The movement of the thighs are psoas major, that's lateral. The lacus, that's lateral. The gluteus maximus, that's dorsal. The gluteus medius, that's dorsal. And the gluteus minimus is dorsal. The movements of the joints for the hip are extension, flexion, abduction, and abduction.
Muscles of the thigh are able to move the piriformis, tensor fasciae latae, iliotibial band, adductor longus, adductor magnus, and the gracilis. All of these abduct are movements that abduct the leg.
Muscles of the hamstring group are able to flex the knee, rotate the leg laterally, and extend the hip. The bicep femoris, semitendinosus, semimembranosus are located on the dorsal part of the thigh.
Muscles of the quadriceps group are able to extend the leg. The rectus femoris is anterior, which is located in the middle compartment of the thigh, and the movement of the rectus femoris is to use 90-degree angle of knee flexion and assist iliopsoas and hip flexion. The vastus lateralis is anterior, which is located in the medial side of the femur, and the movement is to extend the knee. The vastus medialis is superior, which is located from the upper part of the femoral shaft, and the movement is to extend the knee. The vastus intermedius is anterior and is located laterally of the shaft of the femur, and the action is extension of the knee joint.
Muscles of the tibialis anterior are posterior and inferior, and their movements are dorsiflexion and inversion. Muscles of the gastrocnemius are dorsal and inferior, and these muscles are able to do plantar flexion. Muscles of the soleus are dorsal and inferior, and these muscles are able to do plantar flexion as well. And muscles of the fibularis are dorsal and inferior, and these muscles are able to do plantar flexion and inversion. Yeah.